Good day everyone, I am Rosfe, and today I will be discussing about thromboangitis obliterans. For the overview, we have introduction, prevalence, clinical manifestation, laboratory and diagnostic examination, pathophysiology, medical management, surgical management, nursing management, and prognosis. So, what is thromboangitis obliterans? Thromboangitis obliterans or Buerger's disease is caused by small blood vessels that become inflamed and swollen. It is a rare inflammatory condition that primarily affects the small and medium-sized blood vessels of the extremities, particularly the hands and feet. It is strongly associated with tobacco use, and the mainstay of treatment involves quitting smoking. So, for the prevalence, in the United States, there were 104 cases per 100,000 population. Over time, the prevalence has reduced to approximately 2.6 to 20 cases per 100,000 population. Most patients with Buerger's disease are aged 20 to 45 years old. It does not occur in the pediatric or elderly population. So these are the clinical manifestation for thromboangitis obliterans. First is pain, ulcers, gangrene, cold sensitivity, reduced blood flow, swelling, Raynaud's phenomenon, and reduced mobility. Next is laboratory and diagnostic examination. First is blood test. This may be conducted to assess inflammatory markers such as erythrocyte sedimentation rate or C-creative protein to rule out other conditions that could mimic thromboangitis obliterans. Next is angiography. This conventional angiography or digital subtraction angiography can provide detailed image of blood vessels. Angiograms may reveal the characteristics segmental thrombosis and occlusions seen in thromboangitis obliterans. And the last is capillaroscopy. This test examines the tiny blood vessels or capillaries under the nail fold of the fingers and toes. Change in capillary patterns can be indicative of vascular abnormalities. And now for the pathophysiology, we have the inflammatory response. The condition is strongly associated with tobacco use, and it is believed that chronic exposure to tobacco triggers an inflammatory response in the blood vessel walls. This inflammation affects the innermost layer of the vessels called endothelium. For the endothelial damage, the inflammatory process damage the endothelial cells lining the blood vessels. This damage can lead to dysfunction of endothelium, disrupting its normal role in maintaining blood vessel tone and preventing clot formation. Thrombosis formation as a consequence of the inflammation and endothelial damage. There is an increased tendency for blood clot formation or thrombosis within the affected vessels. The clotting occurs in a segmental and recurring pattern, leading to the characteristic ec- ischemic changes observed in the thromboangitis obliterans. Next is vasoconstriction and luminal narrowing. The inflammation and thrombosis result in vasoconstriction or narrowing the blood vessels due to formation of clots and the inflammatory response. This narrowing further compromises blood flow to the extremities. Next is ischemia and tissue damage, with compromised blood flow and affected tissues do not receive an adequate oxygen and nutrient supply, leading to eczema. This eczema can cause pain, tenderness, and in severe cases, tissue damage, ulceration, and gangrene. Lastly is segmental nature of the disease. Thromboangitis obliterans tends to affect arteries and veins in the segmental manner, meaning that certain sections of the vessels are affected while others remain relatively spread. This pattern is distinct and helps differentiate thromboangitis obliterans from other vascular diseases. For the surgical management, first we have the bypass surgery. In the case of thromboangitis obliterans or Berger's disease, bypass surgery may be considered when there are several arterial blockages affecting blood flow to the extremities. This helps restore blood flow to the affected area. Next is sympathectomy. In the case of thromboangitis obliterans or Berger's disease, sympathectomy might be considered as a treatment option by disrupting the sympathetic nerves, which can contribute to blood vessels constriction. Sympathectomy aims to improve blood flow to the affected areas such as hands and feet. Lastly is the amputation. Amputation is a surgical removal of the limb or a part of a limb due to injury, disease, or a medical condition that poses a threat to the person's health. In the case of thromboangitis obliterans or Berger's disease, amputation may be considered in severe cases where blood flow to the extremities is severely compromised, leading to the tissue necrosis and gangrene. And for the medical management, first is antiplatelet agents. In the case of thromboangitis obliterans, antiplatelet agents may be used to help improve blood flow and prevent the formation of blood clots in the affected arteries. By inhibiting platelet aggregation, these medications can reduce the risk of further vascular complications. Commonly prescribed antiplatelet agents include aspirin, clopidogrel, or dipyridamole. Next is the vasodilators may be considered to help enhance blood flow to the affected extremities by dilating the blood vessels. These medications aim to alleviate symptoms such as pain and improve tissue perfusion. And the last is wound care. And for the nursing intervention, we have the regular assess the patient's vital signs, circulation, and extremities. Teach the patient about lifestyle modification, such as avoiding cold exposure and the importance of regular exercise. Encourage patient to express their concerns and feelings. And lastly is ensure the patient receives timely and appropriate interventions. And lastly, for the prognosis, the most critical factor influencing the prognosis is whether the individual stop smoking. Continue tobacco use is strongly linked to the progression of thromboangitis obliterans and a poorer prognosis. Complete sustained smoking cessation is essential for managing the disease and preventing further complications. That will be all. Thank you.